Now to the coronavirus pandemic. Researchers in Illinois say they've identified a new variant of COVID-19 here in the U.S. And they say it's more easily transmissible than the UK and South African variants we've been talking about. And they believe this one may have started right here in Houston. Anieli Ruiz has the latest.
New research coming out of Southern Illinois University Carbondale says they discovered a new variant of COVID-19 that researchers believe is much more easily transmissible than other variants. According to the research, they believe this variant might have started here in Houston back in May of last year, and they believe over time it has spread in the U.S. Doctors here at the University of Texas Medical Branch in Galveston say they're not surprised. They say the virus can mutate easily when it infects humans.
The human immune response will push back on them to eliminate them. And that's why the virus will start to evolve in many different ways and trying to block the host defense so that they can live and survive.
They say the next step should be to continue to monitor this new variant and test it to answer all of the questions that everyone still has.
Does this mutation really matter in a way that really increases the transmission? Or does it really affect the effectiveness of the vaccine or therapeutic antibodies and the antiviral drugs?
But doctors here at UTMB in Galveston don't think this new variant was part of any COVID waves of infection.
Probably not, I would think, because otherwise it would have been identified much earlier. That's of course is my speculation.
Bottom line, scientists hope that more collaborative research is done on this variant to try and figure out if it really affects the transmission or if it affects the effectiveness of the vaccine. Anieli Ruiz, KHOU 11 News.